Well, are you getting enough sleep? No. A recent survey reports that 57% of Americans say they would feel better if they would only get more sleep. I know. And only 42% say they are actually getting as much as they feel like they need. Well, what does sleep has to do with our health? Our medical expert, Dr. David Winter, joins us to explain what all of this means. Good morning, Dr. Winter. Is sleep really important for us?
It is important. Multiple studies through the years have found that people that get adequate sleep are healthier, happier, more productive. They may be less inclined to get infections as they roll through the city. They also may even live longer. Now, how much is adequate sleep? Well, for many people, it's around 8 hours, but that can vary quite a bit. And here's a good judge of that. If you wake up in the morning, you're energetic, you're rested, you're probably getting enough sleep.
Okay, so on the back end of that, if you don't wake up energetic, what does that mean, Dr. Winter?
You know, they say it's a part of our American culture. You know, work hard, you'll be productive, you'll be successful, don't be lazy. Well, this American work ethic, for some people, though, is a problem. You get your brain all revved up, and you can't rev it down in the evenings. I found some people find if they are in that category, they just can't turn the brain off. You want to try to calm down beforehand and then figure out, what are you thinking about? What are you worrying about? Write those down and pack those away until tomorrow. Sometimes that works, Tashara.
Yeah, and I've heard that feedback before, like just get it out of your brain and get it on paper so you're not just sitting there thinking about all the things you didn't check off the to-do list. I do got to ask you about sleep disorders like sleep apnea. Is that a different issue?
Yeah, that's a serious medical condition. Severe sleep apnea can actually cause some heart problems, so you want to check into that. Now, it's characterized by loud snoring, intermittent periods where you just stop breathing for short periods of time. Now, if you have that, these CPAP machines where they put a mask over your face and pump air into the back of your throat, those work well. People that get those tell me they sleep much, much better. I've also found if you have mild sleep apnea, you don't tolerate that mask very well. So you want to get a good sleep study before you think about that next step.
Good advice there. How about sleeping pills? What are your thoughts on those?
You know, over-the-counter sleeping pills like melatonin, some of the antihistamine pills, those work well for some people, and they're pretty safe to take. Prescription sleeping pills, they work well. The problem is sometimes you get on those and you just can't get off of them. So intermittent use of prescription sleeping pills is a great use of medication. If you're on them all the time, you might find that you sleep not very well with them, and you can't sleep without them. So be careful with prescription sleeping pills.
Okay. What advice do you have for us just overall for folks who can't sleep well?
Yeah, it's important, I think, to try to wind down an hour before you want to go to bed. No deep, heavy conversations with your spouse. No action movies. For that matter, you don't want to do heavy exercise in the late evenings. That can kick up your adrenaline. That can interfere with sleep. Heavy meals before you go to bed, that doesn't work very well. You also want a dark room that's cool. You don't want those blinking or those blue lights from your computer or your cell phone around you to keep you awake. And you know, if you can't sleep after 30 minutes of lying there, it's a good idea to get up and walk in another room. Darken that room. Maybe do some deep breathing. Try to relax. Then when you're sleepy, go back to bed. Good sleep habits, Tashara, they're important. They lead to good health.
I know they do, Dr. Winter. I'm just listening to all your tips. Thank you so much. Appreciate you joining us as always.
Thank you, Tashara. Good to see you.